Oh. Can you still see my presentation? Yeah. Okay.
It's good.
So I continue. And the spinal cord injury is the most prevalent part of injury. Among other types of spinal cord injury, cervical trauma, it's up to 50% of all types. And the most common type is incomplete tetraplegia. One of the primary goals for patients with spinal cord injury is to regain sitting balance ability, because lowered sitting balance causes a lot of problems with breathing, torso malformation, which can cause pain. It's decrease bimanual workspace and independence, reaching and pulling, and lowered sitting balance. It's a risk of falls associated with fractures. So reaching an optimal sitting balance ability in patients with spinal cord injury, it is an important goal of rehabilitation, and it is important to maintain an independent daily life. In our study, we had 3 subjects with spinal cord injury who applied transcutaneous spinal cord stimulation, and 3 subjects with epidural spinal cord stimulation. In the table represented their characteristics, the level of injury, it's varied from C4 to C7, age from 20 to 46. Most of them were male and 1 female. And the time since spinal cord injury was over 1 year. And it was one of the inclusion criteria, 1 year after spinal cord injury, chronic spinal cord injury. In our study, we asked our subjects to maintain sitting balance in unsupported position with 3 functional tests. Hands forward, hands sideward, and upward. Before stim, during stimulation, and after stimulation, with 15-minute rest between. Here you can see that we applied transcutaneous spinal cord stimulation at the level T11L1, and for epidural stimulation, we used proximal electrodes, contacts. And stimulation parameters for transcutaneous stimulation was 15 Hertz and 60 up to 80 milliampere, and for epidural stimulation as well, 15 Hertz, 6-7 volt, or 8-10 milliamperes. So all subjects had Vican markers, and 8 Vican cameras registered their sitting. And how do we analyze the posture and balance? We used C7 marker applied over C7 spinosus, and analyzed 4 parameters. 2 of them associated with posture control, and 2 of them associated with balance maintenance. So the height of C7 marker and lumbar angle, it's for posture control, and marker deviation in 3-dimension X, Y, Z, and marker mean speed associated with balance maintenance. So during transcutaneous spinal cord stimulation in hands sideward position and hands forward, the subjects can increase their upright sitting, not only during stimulation but after stimulation. But during epidural electrical stimulation, we do not mention any significant improvement in posture maintenance. What about balance assessment? During transcutaneous spinal cord stimulation, C7 marker deviation increases in hands sideward position and hands forward position. That means balance disturbance in these subjects. But during epidural electrical stimulation, after stimulation in hands sideward position, C7 marker deviation decreases, and that indicates better balance maintenance after stimulation. So we suppose that transcutaneous spinal cord stimulation due to back muscle activation, as this is a wide field stimulation, pretty wide field stimulation, activates back muscle, and that improves posture. Meanwhile, epidural stimulation activates very local rootlets and can be as much effective for posture and balance improvement. So I'd like to appreciate the whole our team who performed this work, and our wonderful collaborators from Children's Republican Clinical Hospital and Far Eastern Federal University, who helps a lot in this work. Thank you. Do you have any questions? Sorry, I can't hear. Igor, I can hear you. Sorry.
Okay, how about now?
Yes, it's good.
Okay, awesome. Yeah, thank you so much for a fantastic talk. Yeah, I have one question. So the subjects you presented, they all been receiving initially transdermal and then epidural stimulation. Is it right?
Majority of patients with epidural stimulation received transcutaneous electrical stimulation. That can be one of the reasons why they keep the posture before stimulation as well as during stimulation.
Mm-hmm. Yeah, so I guess one question we still have with this data set, that yeah, we have very nice difference between well, basically, effect of transdermal stimulation is quite clear, right? So they're all showing some improvement. But for epidural stimulation, in this case, effect is not as clear. Basically, most data show no impact of epidural stimulation. So if those subjects receive both approaches, right, initially transdermal then epidural, probably the best comparison could be another group of subjects who receive only epidural, right, without initial training with transdermal. So I wonder if we potentially could use some other data from patients who receive just epidural and compare with this cohort.
Yes, sure, you are right, but in our department, majority of patients goes through the previous transdermal stimulation and epidural stimulation. So
yeah, again, it could be potential discussion and maybe another way to see this data, maybe for future comparison.
Okay,
cool.
Thank you.
Colleagues, please, if you have any questions, it's a good time to ask. Okay, if no questions, we can move to our next speaker,